Thank you, Dr. Wendell, for the lovely introduction. I'm Nellie Qureshi, and I am a certified medical micropigmentologist and also surgical technologist. And yes, I do both, and I absolutely love it. It's a pleasure to be a part of Medi Tresse today. So thank you. I've been working in here for a couple of years, and I've been a surgical technologist for the last 17 years. A little about medical scalp micropigmentation. We're going to discuss that today. What is microblading? And any other questions that you have at all. Medical scalp micropigmentation is a cosmetic procedure. It's semi-permanent, and it's something that should last a couple of years, depending on your skin type and your lifestyle. We'll match the pigment to your hair color, and the pigment is actually applied to the scalp or the skin on your face, but not detached to the hair or attached to the hair in any way at all. As you see your hair thinning in certain spots or a receding hairline, thinning of the brows due to certain conditions, we can certainly thicken up those areas for you in a very natural sort of way. It does not treat the hair loss, but it gives you a really nice solution to create the illusion of hair. So a little bit more about that later. It's semi-permanent because of the space that we are placing it into. It goes into the basal layer of the epidermis, hence it does not interfere with your hair follicle, which was really important for someone like me as well, who was experiencing the same thing. I certainly did not want to do a cosmetic procedure and have it affect my hair growth or my hair shedding in any way at all. So I wanted to do this for many years to come. Some of the treatments can last a little bit longer, just depending on the technique and the pigment that is used. So depending on what areas concern a patient, we always like to meet you, of course, whether you'd like to come in person or whether you like to do it over Zoom. I always ask the patient what they're seeing because you know yourself best. So we can always do it in the temples, the hairline, the parting, the front of the scalp, or any areas where you have scars, all up to you. And of course, we'll evaluate you as well. Once again, medical micropigmentation allows you to get an immediate result. You can still be treated with PRP, topicals, laser hair cap. You can continue your normal regimen. This is a really nice add-on to prevent you from having, being able to see more skin on your scalp and things like that. So it's a nice solution, but it does not prevent your hair loss or get in the way of your treatment in any way at all. Microblading. All right, lovely. Microblading is a form of micropigmentation, a little bit of a different technique. Once again, semi-permanent, replacing pigment directly onto your skin. We sneak it in behind your brow hair so it goes directly on your skin. I love this treatment because it can really frame your face and give you a nice youthful appearance, highlight your eyes, your bone structure, and also shed minutes off your daily routine. So if you're someone like me who is spending quite a bit of time every day or at the beach or in the morning trying to get in some nice hair strokes, this will prevent you from doing that. So you wake up with a nice brow and the illusion of hair. I'm really careful about making sure that it looks natural. Microblading is a really popular treatment right now. With all respect, we have to make sure that we're making it look really, really natural. Nobody should really be able to look at you and say, you've had your brows done, I want it to be really natural. We do it in a 2-phase treatment for you here. You'd come in for one treatment and then you come in for a touch-up a month later, and it just gives you the nice illusion of a thicker brow, a longer brow, a fuller brow. Lots of us have damaged our eyebrows due to overplucking and due to alopecia as well. So this is a nice solution, and you're usually here for about an hour or so. So when you come in for your first treatment, you're usually here for about an hour and a half. The first half hour is topical numbing, which just feels like an ointment on your face. And if you're doing the scalp, it takes a little bit longer, usually here for a couple of hours. I always tell people expect to come in once and then please expect to come in again about 4 to 8 weeks or so for a touch-up. We like to take our time carefully measuring your brows, looking at your scalp, matching you up with pigment, managing the treatment for you, and most patients do really well with it. In fact, I've never had to stop the treatment for anybody. Everybody does absolutely wonderful with it. You usually look a little bit darker where you've had the treatment for a couple of days, but most people go back to work the next day, no issues at all. The treatment lasts about a year or so. My apologies, I stopped there. The treatment lasts about a year or so, depending on your lifestyle and how you maintain the brows. And I certainly like to give you little tips for that. Most people come in for a touch-up, a year to 18 months. Thank you. Lovely, there's some before and after pictures, just so you can see the picture on the left. Is somebody that had a nice result. That is just with one treatment. And her main concern was the parting on that left side of her scalp. So we managed to get in 3 different techniques there, which I always love to do with a multi-dimensional approach. So we added some hair strokes, we did some of the pointillism, which is the little dots, and then we also did some shading. She was here for about an hour and a half, and those were her results after. Same with the lady on the right. You can see immediately after a little bit of redness, but certainly some nice fullness to her parting there. Thank you. All right, people will very often ask me, I am blonde. Does that mean I'm going to go home with black brows? And I always tell them, no dark brows for you. If you are blonde, we'll do a really careful color match. I apologize. I always take into consideration your features. If somebody's got beautiful blue eyes, I certainly don't want to overshadow those with a dark color. So we take into consideration your features, your bone structure, your skin pigment, your hair, your lifestyle, and you really get to be a part of that plan as well. So the lady on the left here, she, I believe, got some really nice results too, and they lasted a nice 18 months for her before she needed a little top up. And the lady on the right there, a little bit darker blonde, she wanted to rearrange the shape of her brows. And again, I did not do any removal. If you look very, very carefully, you'll see that we thickened up the brow, but we also gave her a nice little lift with an arch. Thank you. These are some of my a little more dramatic pictures. And I'm quite proud of these results as well. Thank you. The lady on the left there, again, was very concerned. She didn't want to have any more brow loss. So we assured her that we would maintain every hair that she's got on her brow bone. And as you can see, we just worked around it, added some fullness to the top there, and then lengthened her brows as well. And that redness there is what most people have once they leave the appointment. It usually subsides in a couple of hours. And then this beautiful young lady on the right here also got a lovely result and some nice fluffy brows. I always make sure I keep them, and I mean this with respect, lifestyle appropriate, age appropriate, and usually patients know what they really want and like, and I make sure that I always listen to them. It's not about necessarily what I think you should have. I like to be a part of the decision too. Thank you. All right, lovely. We're going to move to our live treatment for scalp pigmentation at this point. If you could just give me a couple of moments to set up, please. Thank you.
I'm going to take this couple of moments just to address our COVID situation here. As you can see, both the patient and Nellie have masks. We utilize extreme appropriate precautions and have very strict protocols here. We follow all the guidelines from the CDC or exceed them. and also anything that the Massachusetts Commonwealth requires of us. So we reopened in June, and since that time, we've been very busy, and I believe the patients feel very safe. I feel very safe working here, and we feel that the patients do feel confident coming in. So I just want to reassure everybody that we are treating everybody. We're doing all procedures under the most strict protocols, including the micropigmentation and the microblading. So again, it's a concern I know a lot of patients have. We are still doing consultations via Zoom, but obviously treatments need to be done here in the office. Most consultations are better live, but we appreciate that patients may not be quite ready. We reassure everybody that we are being as careful as humanly possible, following all the recommendations and actually exceeding many of them as well. So we appreciate your concerns, and we
Oh, yeah, is that too bright?
yeah, okay. I'm going to turn it back over to Nellie.
Thank you, Diana. Do you want to I'll get this filled up and then we can.
Yep, so Nellie's just finishing setting up. Can everybody hear me okay? Dr. Wendell, can you hear me?
Yes, I can.
No, okay. So I was just gonna talk a little bit about, so Nellie's already treated the left side of my scalp. So she's gonna treat the right side, and she's gonna show all of you, and we'll share the before and after photos in a little bit. I know that people are gonna ask about comfort level, so I'll just address that first. Because so far it's been a very comfortable procedure. You'll see when she gets started, she has a couple of different techniques that she used that she just described already. I would say, Nellie, is it the pointillism that you use with the device? There's a technique that she uses, you'll hear a little, it almost sounds like, for anybody that's had a PRP treatment, it sounds a little bit like microneedling. It sounds a little frightening, but I will actually say that it's very comfortable and almost even a little bit relaxing. And then there's another technique that she uses where there's a little bit of scraping involved. I did feel that a little bit, but it was very tolerable. I've also had PRP, and I find this much more tolerable than PRP. So overall, it's been very comfortable. So I'm pretty excited. I've already seen the results of the left side, which look really natural. Rosie Scano, our registered nurse, came in and she couldn't even tell what was hair and what wasn't. So I'm excited for you guys to see it.
Ready, thank you, Diana.
You're ready.
Yeah, lovely.
I can keep talking if you
Well, that's lovely. Thank you.
I'll do that.
And we're ready to turn the camera on now. Thank you, everybody, for waiting. So let's have a little look.
Can you guys see us? Anybody? Can you? Yes. Is it clear? Okay. Is that better?
That's okay, we'll be fine. Thanks for your patience.
Oh, it's such a line. You can see in here also.
Oh, yeah. Thank you.
So while we're still kind of tweaking the screen and all of that, I'm just anticipating the things that you guys are going to ask because people ask me these things a lot. One of the questions that I get a lot about micropigmentation is for people that are doing PRP or laser or other treatments for hair loss, when can they do micropigmentation? And Nellie and I have discussed this many times, and we both agree that, you ultimately want to treat the hair loss. Sometimes the cosmetic look, the way that people are looking and feeling, it's nice to get more of an instant result, and that's not something you're going to get from treating the underlying cause of the hair loss with PRP, laser, supplements, whatever it is that we include in your treatment plan. So if people are going to do those things, it kind of depends on what your number one goal is. If you want a quick fix first, then we'll have you see Nellie first and do this, and then you'll come in to see me or Rosie for PRP or OPC, within a few weeks after that. The biggest thing is that when we then take those before and after photos, we're taking the before pigmentation already done. So when we take the after photos, it's going to be a true representation of what you've actually achieved for new hair, thickening and potentially growth from the treatments. If we do it mid-series, when we take the photos, you're going to look better, but we don't know what came from the PRP or the laser versus the micropigmentation. So we choose one or the other, and then we kind of wait a brief period and then follow up. So it's usually about a month before you can do it if you do the micropigmentation first. If you do the PRP or laser, we usually say at least 6 months. We want to get you in for a follow-up first, so that we can truly evaluate pictures your any improvement. It's going to take a full year for maximum benefit, but if people are happy with what they've gotten already at the year mark, it doesn't, I'm sorry, at the 6 month mark, it doesn't mean you're not going to get more. It just means that, at that point we can do the micropigmentation if that's what you want, because even though we're making you look better through the micropigmentation, you've already achieved some result and they're happy.
All right, lovely. We're on live video here. Hello, everybody. Nice to see you. Thank you. So I'm going to describe what we're going to be doing, and hopefully I can say hello to you properly as well. I'm going to be rather casual here and stick my face in the camera and say, hello, everybody. Thank you for joining us. I'm going to describe the technique a little bit, and hopefully you can get a peek in. So Diana has been topically numbing for about 30 minutes with some lidocaine ointment, which again just feels like ointment on your skin. So I'm hoping she's nice and numb. Lovely. And we can always do a little bit more to manage that numbness as well. And I'm just going to have you turn for me slightly. Thank you. Lovely. So the goal is, so I'm going to bring you a little bit closer here. I hope you don't mind. There we go. Lovely. So the goal is to add some fullness through these areas of her temple here. And I'm hoping everybody can see this. And the first technique is going to involve the hair strokes. I hope everybody can hear me okay. So I am using a very fine handheld tool. There is no machine or any rotary in this tool at all. And it comprises, and I'm hoping everybody can see this. I'll bring it a little bit closer. I apologize, I don't know if anybody can see this. You'll have to use the pigment on my glove, but it's comprised of 16 very fine needles that form almost like a little etching tool. And we're going to keep it nice and surface on the skin so it doesn't go too deep at all, because you don't need to go too deep to secure this pigment. And the first one is going to be us putting in some hair strokes, and let me know how you do with this, Diana. All right, lovely. I'm hoping everybody can see a little bit if I angle the tool. There we go. How are you doing there, Diana?
Good.
Oh, well, lovely. And that's just me soaking some of the pigment in her hair. So this adds the nice hair strokes, and we get an accumulation of those. And you can really customize according to your hair growth. So I tell people, if your hair is growing a certain way and at a certain slant, then I will really try to mimic that same. So if your hair's going in a certain direction, I will follow that pattern. And we already did a pigment match here for Diana. The second technique, if you'll excuse the noise, is the pointillism that is done with a micropigmentation tool. You're going to hear a rotary machine coming on at this point. And I'm just filling up the pigment. All these pigments are made from a company out of California called Soft Tap. And I always like people to do their research or ask me questions if they have any. The company's been going for about 35 years. I have been using their pigment for a good 12 years, and I'm very happy with them. Nice, simple, natural ingredients. This is the other part of the treatment, and I'm hoping, I apologize, Diane, I'm going to come around you just so people can see. This is the pointillism. And this is almost like little pixels that we put into the scalp to create some nice volume and thickness. How are you doing there, Diana? You all right?
Yep, this is actually this feels relaxing.
Lovely. So this is why you're usually here for about an hour and a half or so, because I will put in the pigment, we'll take a little break, I check, and then we get thousands and thousands of them in there in your session. And then we let you heal for a month and you come back and we add more of the touch-up. I'm hoping everybody can see this. I apologize if my glove is covering. Coming from here. And you can see Diana is nice and comfortable. I believe nobody needs to be too brave. You just have to be able to sit for about an hour. Lovely. We have some nice ice gauze pads. We make sure we manage your pain and everything while you're here.
I'm not feeling any pain right now.
Keep coming back and we keep checking. You can see we've just added a little bit of fullness. It's normal to see a little bit of redness, but we've just added very subtle fullness through here. We're going to keep working down and graduating back, working on the hairline at the front too. Lovely. Thank you.
Nellie, we have a few questions. Is this
Absolutely.
a good time to maybe take those questions?
Absolutely. You're right with that, Diana. Thank you.
One person asked to clarify what exactly is getting put on the scalp. I know you mentioned it's, if you could just sort of clarify a little bit more about the actual solution than the dyes that are being used.
Absolutely. In fact, that's a great question. Thank you so much. So I am going to actually turn the camera my way, Diana, if you don't mind, just for a few minutes, because I'd like to be able to see you face to face. Here we are. Thank you, everybody. I apologize. I know sometimes with live treatments, you can't see everything. All right, lovely. I'm Nellie. The company that I mentioned is Soft Tap, and the solution that I have been using that I really believe in is iron oxide glycerin and alcohol are the main ingredients. And of course, you're open to get that information from me at any point at all. Most of them are natural pigments. I really want to be careful, knowing best that I know what you're putting in your skin and what I'm putting in your skin for you. So iron oxide, glycerin, and alcohol are the main of the pigment.
I think we're having internet issues.
Is it letting you join her?
No problem. And I can move into a different room.
I
for the
think we're
questions
back
if you
on
like.
now.
I can always move into a different
Dr.
area.
Wendell, can you hear us? We're back, okay.
Lovely.
Sorry about that, technical difficulties.
So good.
In case anyone's wondering too, I actually don't know who's on here. I'm assuming that it's probably some of my patients. Some people know this, some people don't, but I actually do have PRP treatments done. I've been doing them every 6 months for 3 years. So my hair, a lot of times people don't know why I'm doing them because the way that I wear my hair, you can't really tell that it's thin like this. But I did get a pretty decent result from the PRP treatments. I'm pretty happy with it. But this is something that I've always wanted to do because when I wear my hair in a ponytail or even my hairline a little bit really bothers me. And I've been working with Nellie for 2 years now, and seeing her work is amazing. And she's very talented and I trust her completely. So I was more than willing to jump in this chair to let her do this on me, and actually very excited to do it.
I think back to Dr. Wendell there.
Okay, well, I'm not seeing questions at the moment, so I unfortunately I got bounced off the webinar and my questions aren't showing up. So in any case, if anybody else can see any further questions, there's one right there. Okay. Somebody asked about cost. Can you sort of give a ballpark figure, Nellie, about cost?
Absolutely. For the brows, we charge $800, and that includes your touch-up. So when you come back for your 4 to 8 week touch-up, that is included in the cost of the brows. And for the scalp, the cost starts at $1,200. And we always want to be generous with our patients. So if you come in, we'll evaluate, we'll give you a nice idea, depending on generally how long it's going to take for the treatment. So the scalp starts at $1,200. And again, that includes a touch-up for you. We always want to take care of patients. If you need another touch-up, it's never a concern. We'll always make sure you're happy.
Thank you. I'm not sure we answered the question about the white hair. That's when I got bounced off. So was that adequately answered?
No, we didn't address that.
No, we'd love to go over that actually. So a lot of patients that do have white hair or that are graying and want to stop coloring their hair one day will often ask me, what if I decide not to color my hair one day? What implication is the pigment on my scalp going to have to that? So I always like to keep the pigment really, really natural looking. So even if you are blonde and you are getting this pigment right now, and one day you're going to go gray or decide to let your hair, stop coloring your hair, the pigment choice is used more or less according to the pigment in your skin. And I know that sounds a little bizarre to some people because they think, well, my hair is blonde. And if your skin is fair, I'm going to choose a lighter pigment. Most of the pigments are really neutral in color. And once they're placed into the skin, your pigment in your skin actually blends with the pigment that we're putting on in there. So we like to keep the pigment really, really neutral, very natural looking. So even if you did go gray or white, you would have an underlying pigment of a darker color underneath, which for most people isn't an issue, of course. If that was something we could also plan in the future for you, the pigment would last a couple of years, and it's certainly something we could let fade out too if you needed to. But even if you are gray or white in hair color, you're still a great candidate for this because we'll just match it on a lower degree of a tone for you in a very neutral base.
Thank you, Nellie. Another question, somebody asked, can you continue to color your hair after this process? I guess the question really is timing. Yes, you can color, but can you sort of describe the timing?
Absolutely. I always tell people they can get their hair colored a week or so before they come for their treatment. And if they don't want to, I just usually have them wait a couple of weeks to get their hair colored, just because I want to see you nicely healed. So you can get your hair colored right before, so I can see your hair at its best. Once again, I'll use a really neutral pigment because I am taking your hair into consideration, but I'm actually looking more at the color of the skin on your scalp. Or you wait 2 weeks after the treatment until everything's healed. And a lot of hair color has alcohol in it, so I always want you to wait so that you don't fade the treatment that I've done for you. So you can.
Great. This is unrelated to micropigmentation, but so I'm going to address it very quickly. Somebody asked what hair care practices can lead to hair loss. We've discussed this in some of the other webinars, so you might want to go back to the website and see. In fact, I believe I spent an entire webinar talking about things that we do that can cause hair loss. So there are many things, whether it's excessive pulling of the hair, cornrows, extensions, tight braids, tight ponytails, also some chemicals, in certain sensitive individuals, some kind of over dyeing or straightening or perms, interestingly, can lead to hair loss. But again, these are all questions that we ask during a consultation. And if we believe that's contributing to it, we would encourage you to stop doing that. If you have specific questions about that, we would be happy to contact you afterwards. Another question, somebody said, can you do this procedure after hair transplant, which is a great question.
Yes, you can actually do this treatment after a hair transplant. I always tell people to get clearance from the doctor. And usually most doctors will recommend that you wait several months because you want to see the full effects of the lovely hair transplant that you've had as well. So I always look for doctor's clearance with something like that. But yes, if you need a boost in certain areas, you can.
That's great. Well, that is actually the end of the questions. If somebody else has any, please address them now. We are going to, as with all of our webinars, this webinar will be on our website. Somebody just popped up a question. But we also, I believe we're going to try and do Diana's before and after photos. We will send out an email to all of our participants, and we're going to try and include those so you can get a very close look to the before and afters on Diana, the treatment that you're watching right now. So, okay. Let me just see. Okay, these questions are actually put into the chat, so I will quickly, some of these we've already addressed. Yeah, so somebody asked if you and maybe this was in the picture that you showed of the treatment, do you draw the eyebrow shapes with a pencil before doing the final treatment so the client can approve the shape? So before you do it, is there a discussion about, you know, how wide you want it and how long? So.
Absolutely, it's such a great question. I apologize if I did not address it. So we spend a good 15 minutes or so at your appointment actually talking about how you would like your brows to look. We spend a decent amount of time drawing in your eyebrows. I first do a little measure, but I certainly never want your brows to look measured. But we do try to get them as symmetrical as possible, yet still natural looking. But I always tell the patient they have the mirror in their hand. I want them to be involved in the treatment. It's not just about what I think would look good on you. I also want you to tell me how you would like your brows. Some patients like to bring in a picture of themselves from a few years ago. I think I once had a lady bring in a picture of herself from about 40 years ago, and she wanted to look like that, and that was absolutely delightful. So I love it when patients tell me what they like. I want you to be involved. We measure. We talk about the shape. I have you move your brows around a little bit to see how they look when you've got expression. We mostly, almost always keep every single brow hair that you have. If you need a little bit of a cleanup with some tweezers, I'm always happy to do that for you. But my goal is really to maintain all your brow hair. And we work around it to enhance it nicely. And we also talk about pigment, which is really, really important. So we'll test some pigment on your forehead and see what you like, see what I think would be nice. I always want it to look natural for you. We can always add more. We can always change the color within a reasonable time. So yes, I usually spend honestly about 20 minutes doing that before we do any treatment on you. Dr. Wendell?
Several people have asked, Nellie, where you do this treatment, which office? And yes, we are. Oh.
I think we're back on, Dr. Wendell. I apologize. Is it this room?
It's my computer.
Okay.
Do you want to come in here?
Of course. Would you like to?
I'll stand
No, no, please don't worry.
up. Somebody asked about where you do this, which office?
Can everybody hear us now? Lovely. So I believe some patients are asking where we do this. And I always tell them, I'll come anywhere you want me to come. But joking aside, I love coming to this practice here in Wellesley, and we're performing it at the Wellesley office.
Are there any more questions?
Does anybody have any more questions for us? Yes, another patient's asking if we see patients at the Wellesley office, and that's exactly where we do. Thank you. The initial evaluation cost, a patient is asking if there is a cost for the initial evaluation. And I always tell patients, I would just love to see you and spend some time with you. There is no initial evaluation cost. I want you to feel really comfortable. Come in, meet me for half an hour. You can come in for longer if you like, and we can go over everything with you. So no, the initial consultation is at no cost. And another patient is asking if we have had clients with hardly any eyebrow hair. Yes, we have. We've had plenty of patients that have unfortunately lost most of their eyebrow hair, and I'd love to share some of those pictures with you as well when we email you. And of course, you should have some nice results with that as well. So yes, it's in fact a great option for patients with hardly any eyebrow hair.
And it surprisingly looks very natural when it's done.
Another question, Dr. Wendell, if you don't mind me interjecting here, a patient is asking, when swimming and when your scalp is wet, is the treated area noticeable of the scalp that is covered? And actually, that's a really great question, because lots and lots of our patients notice their hair looks thinner when they're at the beach or when they're at the pool. So if I feel that you're not going to get the most natural looking treatment, even when your hair is wet, I would always want to tell you up front that this may not be the best option for you. But in most cases, it's actually a really great option for people that swim a lot. So I always have you wait 2 weeks prior to returning to your swim routine. But it's a great option because once the scalp is healed over, the pigment lasts really well through that and can make your hair look thinner even when wet. Thicker, I apologize, can make your hair look thicker in spots where it's thinning even when wet. So that's why we do it in the 2 phases, because I really, really want it to look natural, and I always build on it for you. Another patient is asking, oh, I apologize, Dr. Wendell, please go ahead.
Yeah, somebody asked if you can do both scalp and eyebrows at 1 visit, or is that a 2-visit treatment?
No, absolutely, you can. The eyebrow treatment itself only takes about 20 minutes. It's more the evaluation on your face that takes a half an hour. But you can do both scalp and eyebrow treatment at the same visit. And then when you return, we'll do the touch-ups for both on that 2nd visit as well.
Great. And another excellent question about someone being allergic to a lot of products. Is this a common problem, allergic reactions, or if someone's allergic, do you ever do test doses?
Absolutely, and thank you for that question. So in the years that I have been practicing, I have not seen an allergic reaction to this product. If I had, I would obviously tell you. I feel it's the right thing to do. I haven't, and in fact, we've treated some people with high allergies, such as allergies to parabens and products in shampoos and conditioners. If I've treated people that have skin issues. So if anybody has that, I always tell them it's always best to come in for a little test spot. We can always do a little test spot on your inner arm, just of a few pixels of the pigment. We'll watch it heal for a week or so, and then you can come back and resume with treatment. So honestly, no, I haven't seen a lot of allergies. We've been very fortunate, and in my career, I haven't seen any at all.
That's great. One last question, because we're almost at 1 o'clock here. Somebody asked about the cost of the micropigmentation. What kind of area would you say the initial $1,200 would cover? If you could give sort of a diameter area.
Absolutely, I can. And what it tends to be is most people will come in and they want the front of their scalp addressed or the hairline. So if I was to give you a diameter of an area, I would say, again, we always want to take care of our patients really well. So I would say, I never want you to hold me to this, but I'd say maybe a good 6-inch diameter of an area. But most patients tend to want to address the front of the scalp or the parting. So I would say if you've got a nice long parting and you want to taper it off into the temples a little bit, that would be the $1,200 cost. And then it goes up in increments from there, but we've never charged anybody beyond $2,400 or so. So that's the range.
And again, this is one last question, just to clarify, how long does the pigmentation last?
That's lovely. And I'll always tell you things that you can do to really make this treatment last. So in general, I always like to tell people that the brows, the microblading of the brows, usually lasts about a year. If you are a swimmer, if you swim in ocean water and chlorinated water, if you use a lot of retinol products on your face, or you get lots of chemical peels and you go and get nice facials and they're going over your brows with lasers and things like that, I would say you would be closer to the mark of 10 months. But if you're careful and you baby the area around your brows, it can last about 18 months or beyond. The scalp, most people are washing their hair every 2 to 3 days. That lasts a little bit longer because we're using a machine tool. So that usually lasts about 18 months or so.
Great. Well, anything else you feel people should know, Nellie, before we close?
No, thank you everybody for your time, and thank you, Dr. Wendell, and everybody for supporting this. It's a lovely solution. It always makes me laugh because this is certainly not a technique that is new in the medical industry, but it's an area that men have been hogging for a really long time. So I'm really happy that we're introducing it for women, and we've added a softer touch to it. It's been going years and years, and like I said, mostly offered for men. And we've added a nice soft touch to it for women. So I'm excited to be a part of it. Thank you.
That's great. And thank you, Nellie, so much. And Diana for offering to be our patient today. As with all the webinars, they will be available in the entirety on our website. If you go there, you'll notice there's quite a few there. We were busy this past spring. So feel free